welcome to the Health Collective. I'm Amita Tripathi, in conversation today with renowned psychiatrist Dr. Vikram Patel. Thank you for taking the time for this interview.
Thank you for having this interview.
So, I want to start by asking you how important it really is to maybe normalize conversations about mental health and mental illness. Especially in a country like India, where we know that the stigma is still very much something people deal with on an everyday basis.
So I think mental health is something that we should all as human beings aspire to. So I want to first of all distinguish mental health from mental illness. We often, when we use the word mental health, actually de facto most of us are talking about mental illness. Actually, mental health to me is a positive, valued aspiration for all human beings. And if we accept that that is what mental health is, then of course it affects us all. And we need to disconnect mental health from mental illness to be able to have a more open conversation about this valued aspiration in our lives.
And do you find that, we're moving the needle somewhat, at least in the last few years here in India, at least in the mainstream and areas you're working on, because even given that the categorization, do you find that where it's more comfortable now for people to talk about mental illness? Because sometimes you see in the sort of narratives we see, if you have a celebrity who talks about depression, for example, that does shift the conversation to a more positive. But then you're talking about maybe say neurosis, not psychosis. Can you take us through a little bit of what you think is okay now for people to talk about, and maybe your initiative, it's okay to talk?
So first of all, I want to say that I think there's been a really dramatic transformation in the openness with which people are talking about mental health, also the sensitivity with which this subject is being discussed. I can remember 20 years ago, for example, if I went into a ministry or went to a media house and said, I want to work in the area of mental illness, they would usually laugh at me and say, this is not an issue that is of public interest. And even if it was, it's something that is really quite embarrassing, shameful, scary to actually discuss. Today, on the other hand, here you are interviewing me about my work, about mental illness and mental health. And that in itself is just a sign of the broader change that is happening in society around issues with mental health. So this is something I'm really very pleased about. We should celebrate this and hope that this continues. Now, the point you made about celebrities, I think, is an important one. I personally think it's a very important aspect of the openness with which mental health is being discussed. However, there is one caveat, and that is that oftentimes people think that mental health is a discussion for the rich, the well-off, the affluent, etc., the westernized. And therefore, the assumption is that poor people, who represent the majority of our country, really have more important things, the more basic needs to be met.
And that mental health is somehow something of a luxury item for poor people. Actually, the truth is that mental illness is much more common amongst those who are poor, disadvantaged, discriminated, marginalized. And I just want to sort of hope that these celebrity disclosures don't perpetuate the myth that mental illness is a problem of the rich and the affluent.
And when we look at sort of the numbers, right, because you've alluded to how common it is to see mental illness in different segments of the population. But broadly, when they say, for example, that statistic that 1 in 4 people at some point will have a mental health episode in their lives. Does that hold for India? Is that a number that you're comfortable saying as a big picture? Because sometimes it's important for people to realize that it's it's everywhere. It's practically every family that certainly I meet nowadays. Somebody has a story and they want to share, or they want to talk about. Do you think that 1 in 4 number is something that's accurate for India?
So look, first of all, I want to just say again, draw your attention to the point I made earlier, that mental health and mental illness are not the same thing. Mental illness is a biomedical entity, where we diagnose people with disorders as defined by, say, the World Health Organization. So in this way, you divide the world into people with a mental disorder or without. It's a binary approach. If I take that particular approach, then the National Mental Health Survey of the Government of India, which was just published earlier this year, is probably the best data that we have on the prevalence, that is to say how common mental disorders are in India. And that survey showed that about 1 in 10 adult Indians at any given point in time will have a mental disorder. This also includes substance use disorders like alcoholism. However, that doesn't necessarily mean that the other 90% are enjoying good mental health. We may have no mental disorder and yet have poor mental health. And I think a very good example would be suicides. Quite a large number of people who end their lives through suicide may not meet diagnostic criteria of having a mental disorder, but surely you and I will agree that they couldn't have been in good mental health if they chose to end their lives. So this is quite a complex, I think a complex set of what seem to be contrasting views of mental health. That is something we all have at every given point in our lives, and mental disorder, which is a kind of a diagnostic entity which then triggers a range of different clinical interventions.
Would it be safe to say that the numbers might be underdiagnosed, given that I want to ask you also about, and maybe to club both questions in one. We know that in India, in terms of trained mental health professionals, there's a huge shortage of resources. And I wanted to tie that in with some of the work you've been doing. But the last number I heard was, say, 5,000 trained psychiatrists in the country, so maybe 1 per million. It's working out to some ridiculous number like that. Do you think it's possible that we're seeing numbers that are cases that are underdiagnosed? And what would you say about the paucity of resources?
So again, the National Mental Health Survey of India gives us very accurate figures on the proportion of individuals with a mental disorder who have sought help or received help in the last 12 months. It's a staggering proportion. Only 5 to 10% have actually received or sought help. But put another way, nearly 90% of Indians who are currently affected by a mental disorder have neither received or sought help in the last 12 months. Now, there are many reasons for this. One obvious reason is that there is inadequate supply of skilled human resources, particularly within the formal health sector, to address mental health problems. But also equally, one must acknowledge that there's a demand side issue. That is to say, when people have the experiences that we consider are signs of mental disorder, they don't necessarily think that they have a mental disorder themselves. Very often, in fact, the most common way that in our culture, in our society, people understand the experience of mental disorder is through using social explanations. For example, I'm feeling the way I am because something terrible has happened in my life. For some people, they may invoke supernatural or spiritual or religious explanations. For example, my luck is down because I may have committed misdeeds or I have sinned. And therefore, even though the experiences are very distressing, you don't really think of going to see a doctor or a health worker because you don't conceive of it as a health problem, leave aside even a mental health problem.
Right. And how do you see that conversation changing, if at all? I mean, are we...
Well, I think this is to me a really important challenge. But I can draw on some of the work we did in rural Maharashtra, a program where we actually sought to change the narrative about mental illness in rural communities where there was a high proportion of individuals who were attempting suicide. In fact, the epicenter of farmer suicides in India, which is Vidarbha. And over a period of a couple of years, we engaged with communities, with, for example, panchayats, with village health workers such as ASHA workers and Anganwadi workers, with just key people within the village community, and began a dialogue with them to understand how they explained mental health experiences, and incorporated those values, those ideas, those beliefs, the metaphors within our own communication strategy. And I'll tell you, the results were quite staggering. When we started this program, only about 5% of people who met diagnostic criteria for depression had actually sought help. At the end of 18 months, when we repeated a survey to look at the impact of the program, this proportion had shot up 6 times to nearly 30%. Now, of course, it's not yet 100%, but even going from 5% to 30% in 18 months, purely through engaging communities, is a reflection of what strategies we need to use.
And you've spoken also about the need to deliver healthcare via whatever resources are available. Will you take us through a little bit more of that model? And I know in some of the work you're doing in Goa with Sangath.
Yeah, sure. So earlier you brought up the point of the very small number of mental health professionals in India. Actually, that small number is further exacerbated by the distribution of that small number. That is to say, the majority of that limited number actually live and work in urban metro areas or on the private sector, essentially excluding the majority of the rural poor from accessing even that small number. So in some parts of India, there might only be one public sector psychiatrist for several million people. Now, it's very obvious that with that small number, we do need to think of alternative human resources to deliver mental health care interventions. But I would also suggest to you that it isn't just about the number of mental health professionals that is important here. I would also propose that many mental health care interventions do not in fact need a mental health professional. That given the scale of mental health problems in our society and indeed globally, and because mental health is something that should concern all of us, even if we don't have a mental disorder, it seems to me that we must empower every individual in our community to understand the skills through which one can promote and protect our own mental health. So the most important human resource for me is each and every citizen.